So this is a presentation on our behavioral response unit. This is a pilot program that we started here in 2020. So kind of just to share some mental health statistics with you, 44 million people a year are experiencing mental health in our country. Almost 10 million report serious mental illness that interferes with their life. And 16 million reported at least having one major episode within the past year. Here in Orange County, here are our statistics. These are calls for service that our deputies respond to every single day here in Orange County. That's over 20 per day. And these range from people in mental crisis to suicide attempts to suicides, all kinds of calls related to mental health that keep us extremely busy here in the Sheriff's Office. And so law enforcement has been tasked with these issues more than any other group. And there's a lack of training, there's a lack of support, a lack of community resources for people suffering with mental illness. And people are most likely to be arrested and or incarcerated. So what I want to do is I want to kind of explain different response options that we have, and I'll go through each one of these and tell you the ones that the BRU is. So the Memphis model is it's a police-based first responder model where all of your deputies or officers are trained in crisis intervention. It's a 40-hour class, and it's amazing training. And this is what, in effect, we've been doing for years here, but some of the challenges with crisis intervention model is that for large agencies like ourselves, it's hard to get every single deputy trained. They only offer the training several times a year, and we're competing with every other law enforcement agency in Central Florida. But that's the crisis intervention Memphis model. The next model is the clinician response team, and this, you may have heard, this is the model that's similar or most similar to what the city of Orlando is doing in their pilot program. And so when a call comes into the 911 center, the 911 call taker triages that call and decides whether they should send an officer or a contracted clinician. If it's diverted to the clinician receives the request, decides if it's appropriate based on the circumstances, and then they will accept, and they usually respond within 60 minutes. But they will only respond to nonviolent calls, nothing involving an armed person, and there has to be no history of violence. If the clinician response team, the civilian clinician arrives and discovers it's not safe, then they will call an officer on their radio to respond. Or if they have to Baker Act that person, they also need to call an officer to respond to the scene that they're at. So when an officer responds to a person in crisis, they can also request an on-call clinician. So this is yet a different model where police departments and sheriff's offices contract and they just call a clinician to respond, and they generally respond in under 90 minutes. And yet another model is the virtual clinical support, which some agencies are using here in Florida. So that's a deputy or an officer responds to the scene of someone in crisis, and they connect the person in crisis virtually with the clinician by use of an iPad. But we've heard instances right here in Florida where obviously you don't want to get too close to the person, so the iPad is delivered to the person in crisis. And we know one agency that's already had 2 iPads smashed on the ground because the person was experiencing some type of mental crisis. So the model that we are using for this pilot program is called the Correspondent Model, and that pairs a law enforcement officer with a mental health clinician, and they ride in the same car as partners. So they respond together with their combined expertise of law enforcement and also behavioral health, and they help de-escalate situations of people who are having these mental health issues. It's one of the most popular models worldwide, and including other countries as well, and they can respond to many incidences, especially with people who have a history of violence or who are threatening others. So they can also quickly work together and get together and put together a risk protection order if needed and respond faster to calls for service involving mental illness. And you know, the idea behind this is to create this partnership pairing clinicians with our deputies to de-escalate situations and help get the people the services they need regarding their behavioral health. And they also help bridge the gap between all these different services, law enforcement, hospitals, the VA, and different mental health services. And they could address multiple needs, mental health, medical and criminal issues, even homelessness issues. And so also what happens, a great part of this co-responder model is when the co-responder team is at a call, usually there may be some other deputies there that either responded first or had come to the scene as well. So there's a lot of training that goes on the scene of seeing how the clinicians deal with these people in crisis. And basically, we're trying to change the culture when responding to mental illness. And this means reducing arrest, reducing Baker Acts, and of course, keeping our citizens, residents safe. So what does the co-responder model do? It increases the access and speed to care. It increases collaboration between law enforcement and all our mental health practitioners. It increases safety of the clinicians, increases the accuracy of the needs assessment, and it improves the immediate response to the crisis situation. And here, just as importantly, it decreases use of force, decreases hospitalizations, the repeat calls for service. Many of the people that we respond to, we've dealt with them 20 or 30 times. It also decreases arrests, which cost money, in SWAT calls as well as civil lawsuits. So here are some of the agencies that are using the co-responder model throughout the U.S. and some of their success stories. In Los Angeles, the cases were significantly more likely to be resolved without hospitalization, and costs were 23% lowered. Only 2.8% of the calls resulted in force being used, whereas if their patrol officers responded, sometimes as high as 50% force was used in these mental health crises. In Knoxville, a low 5% arrest rate for every 100 persons, with 42% taken to a treatment location in lieu of arrest, and 17% of the situations resolved on site there, with 36% referred to treatment. So in Kansas, the rate of hospitalization fell significantly, and then repeated law enforcement calls for the same person decreased greatly because of the initial contact with the co-responder. And then in Boulder, contact with nearly 1,000 people, only 2.4% of the encounters resulted in arrest, and their program, they estimated costs around $600,000, but they believe saved over $3 million in jail costs due to fewer arrests. So here are some of the other agencies across the United States. You see all over the United States, people are using this co-responder model. So very proud of the Sheriff's Office because we started looking at this co-responder model and really all the different models back in 2019. Our very own Major Carlos Torres, he was tasked with all the research to look at all the different models, and we sent him to California. We also sent him to South Florida as well to look at, I think he looked at 3 or 4 different agencies and their models. We talked to subject matter experts. We did a lot of research, and after a lot of consideration, we decided the co-responder model would be best for us here in Orange County. And so in 2020, we created this behavioral response unit to address our needs here. So this is a pilot program. The program as it exists right now is currently comprised of a sergeant, 2 crisis intervention trained deputies, and 2 clinicians. The clinicians are contracted through BRU under a memorandum of understanding. They all went through 40 hours of specialized training together on how to de-escalate situations, on how to deal with different scenarios. And they wear different uniforms than our deputies do, so I'll give you a picture of that. So as you see, those are our deputies on the left in the green shirts, clearly marked sheriff, and the clinicians are in civilian clothes, with the clinician clearly stated on the back, so to differentiate who's law enforcement and who's clinician. It's a lot softer look, we think, that helps with those folks that are in crisis. So basically, they work together as a team. They ride in the same car in an unmarked vehicle, and they respond to these high-risk situations, people who may be suicidal, who may be in mental crisis or experiencing PTSD. So like I said, at the beginning of the shift, they get in their car with the deputy, and they spend their time out in the community and available to respond to calls for service involving mental illness. And so what happens is, as you can imagine, with over 20 calls a day, we have to send deputies to these calls, and sometimes they'll be able to call for a behavioral response unit, which frees them up to go attack other issues in our community, such as fighting crime. And the beauty of the BRU unit is they can spend a lot more time with these individuals and getting them the services they need. The other thing they do is conduct follow-up. So if they respond to a call, or one of our deputies responds to a call with someone in crisis, we're tracking all of that, and then we're going back to them to see if they're need any assistance, to see how they're doing, to see if they're up on their medication. And so, obviously, we're never going to place the clinician in harm's way. The scene must be stabilized. They must be with the sworn deputy. And they're also going to conduct ongoing training for our agency and kind of develop a best practices model when we are responding to these calls. One of the things they also did is they also created, these clinicians and these deputies created the Central Florida Law Enforcement Mental Health Coalition, and that's a group that's going to share information with all the local agencies around here about mental health services. So they're really going to partner, in this region regarding this issue. So they've been out there for 2 months. They went to all our patrol squad briefings to kind of tell the other deputies what it is they're doing, why they're out there, and how they can be helpful. I already talked about the Mental Health Coalition. So they received 700 mental health referrals from our deputies, from our citizens, and they actually went out on 250 calls for service and follow-ups related to mental illness. So in those 2 months, the entire Sheriff's Office conducted 385 Baker Acts, and the Behavioral Response Unit conducted 16 Baker Acts and made no arrests. So one of the interesting things that's happened also is our great partners at UCF has tentatively agreed to conduct a program evaluation of our Behavioral Response Unit. And what I'm going to do now is kind of go over some of the, just a few success stories we had. We responded to talk with this mother. She'd been having problems with her son. He chose to live in the woods. She felt her son was not eating properly. He was severely underweight, and she felt that he could not continue living basically on what he was eating. So again, we had time to do this lengthy evaluation. He was taken in for a Baker Act and is now in a long-term community facility. They were able to direct him to the exact resource he needed. We also responded to a call about an older man who had medical issues, and he was refusing to get help. So he had not left his house in 8 years. He had been in a wheelchair for 6 years, and his family just wanted him to get the help. Our Behavioral Response Unit responded. They were able to Baker Act him, and now the individual is actually out of the wheelchair. He's receiving the medical attention in a local facility because they directed him to that. And his family told us they never thought he would walk again, and they're very, very thankful for the intervention of the Behavioral Response Unit. They also responded to a veteran who was planning on killing himself, and he was in a vehicle at the end of a road. The BRU clinician was able to talk to the veteran safely on a phone and talk him into turning himself in to the deputies on scene. He was able to be Baker Acted and taken to the VA where he is receiving treatment. We had also conducted follow-up with a lady who had been recently on Baker Act because she attempted suicide. Again, after lengthy evaluation by our unit, she broke down and admitted she was planning to take her own life when we were following up with her. So, had it not been for the behavioral response unit going back to her to see how she was doing, she may have taken her own life. And we're going to continue to follow up with these folks. So every day, our people are out there meeting with members of our community who are experiencing mental distress, and all in an effort to prevent unnecessary hospitalizations, arrests, and Baker Act. And instead, they're going to do these evaluations and really try and connect them to some of the community resources that are appropriate for their needs. So, in conclusion, we're going to work towards reducing the individual exposure to the criminal justice system, and strive to lessen their contact with law enforcement while making sure that they receive the treatment they need. So the action that we're requesting is to spend $115,000 from our law enforcement trust fund, the money that we get here at the Sheriff's Office from state forfeitures, to cover the salaries for the BRU clinicians for the behavioral pilot program. And so I am happy to stop sharing my screen and take some questions. I will say we've already been contacted by several municipalities and counties throughout the country in order to learn about our pilot program, and people are really interested about it. Something we're very, very proud of, something that we hope the board would support us on as well. But happy to take any questions.
Well, we have a number of commissioners who have pressed a button to indicate that they have some questions or comments, and then I'll bring up the rear. Commissioner Wilson, you're first.
Thank you so much, Sheriff. I will tell you that obviously with current events being where they are, this has been a conversation we've had with so many residents, and I had a couple questions and then a comment. My first question is, how would this work, or how does this work in conjunction with school resource officers or events at the school where there's a 911 call?
So great question. Obviously, all of our school resource officers are crisis intervention trained. They also have specialty training in autism and other illnesses. So, but they are available to call our behavioral resource our response unit as well. So if they know a child who may benefit from this interaction with our behavioral response unit, they could call them as well. And I will tell you, Commissioner, I've heard the stories around the country and here locally about especially kids dealing with autism. It's something we're very sensitive to. One of the first things the school does, as well as the SROs, we get in touch with the parent and make sure the parent is on the way and communicating with us, especially if their child is in mental crisis. And during that same time, we would call our behavioral response unit as well to help respond and de-escalate the situation as well.
It's interesting because you brought up the case or example of autistic student, and actually one of the things I was thinking about during this presentation is some folks I know who actually didn't call 911 when their son was having a seizure because they were so concerned about, the order of arrival of emergency services and whether or not, that there would be something that escalates. And so they literally self-cared during a seizure, which to me was breathtaking. But this leads me to my next question, which is, are you all doing a kind of a communication or a public relations portion of this where people then know about it? Citizens, I know you said that there were groups in the community and the schools know, but just citizens that maybe are hesitant and literally are trying to weigh the options of whether or not to call 911.
So great question again. A few things on that. We've blasted it out on all of our social media platforms. We have presented it to our Citizens Advisory Council, and we've also talked about it with the Orange County Task Force the mayor put together. The Orange County Safety Task Force, and actually that's going to be one of the recommendations that you'd hear in a while. And then going back to autism, I did fail to mention that all of our new deputies go through autism training and how to deal with people who are in autism. And the neat thing about that training is we actually have two young men who have autism who their parents allow us to interact with during the training. So it's great training, something that we're very sensitive to and really on the cutting edge of.
Great. Thank you so much. I think it'll be a great comfort to people in the community. I appreciate you.
Thank you.
Commissioner Uribe.
Good morning, Sheriff Mina. First of all, I'm honored to serve on this board with Captain Torres, and I think it was 2 years ago. It was definitely before COVID. My husband was able to join the team as they went to Miami, and I really want to thank you for bringing this and making it a reality. We've been talking about it for almost 3 years. We had the data to support it, and to see you put this action into play. And hopefully, I have to also, a shout out also for Chief Quinones, who has been a strong advocate so that we can prevent innocent people from being arrested and give them the care they need with mental health. And we continue. What makes me so proud is to be a commissioner during this time as we lead in this effort, and it's great to hear. And it's I'm honored, and I would love to make the motion when it's time. As a board member and vice chair who serves with Chief Myers also, it really has been a collaborative effort of everyone, and I'm really proud of today and the step that you're making to make this a reality, because we're going to prove that we can really take away, and you can't help but also know that when it comes to financial and racial disparities, who even have less knowledge of the mental health, this could really help curve those numbers that we see. So I'm so proud, and thank you to everyone, and a big thank you to Captain Torres, who gave us a lengthy report when he went to California and all he had to see out there. So great job, and keep doing this. So thank you.
Thank you for your support.
Commissioner Moore.
Yes, thank you. I think this is a great initiative, and I look forward to maybe you'll be coming back in here with some data, and we can see some results in terms of reduced arrests and that sort of thing. My question to you would be, is there cross-training from the safety side for the mental health workers from BRU that you're going to employ?
Yes, correct. So they already went through that training with us to ensure they're as safe as possible, and they're going to be with one of our sworn deputies, and these are both experienced deputies, but we're going to ensure the scene is stabilized before our clinicians there. We're going to be sure that everything is safe and secure before that person interacts with the person in mental distress.
I'm hoping the 911 operators, when the call comes in, a family member, I've had to deal with some family members with mental health issues over the years, and they can be helpful in terms of knowing how that person de-escalates, when it's truly a law enforcement issue versus just an episode. So I'm assuming that you've done some training with your 911 operators to help make this go more smoothly, or you will be doing.
Yes, absolutely, and that's the key, Commissioner. Is from the time the call comes in, our dispatchers know about this program and see if they can divert that call to our behavioral response unit. While at the same time, especially if it's a situation that is escalating, to make sure that our deputies are responding as well. But yeah, everyone will be tied in together, from dispatchers to the patrol deputies, school resource officers, and the behavioral response unit.
Well, it's the right way to go. I remember on the school board, when probably 10 years ago we talked about incidents, the state started monitoring the numbers of restraint and seclusion incidents in the school, and the answer was always additional training on how to de-escalate situations. So I applaud you on that. And then I also want to thank you after the Clerconacoe accident. Ed Gaymar, I had immediately called Captain Carter, who's been extremely responsive to our office, and I checked on it the next day, and there were motorcycle speed control officers out there on Claire Conacoe. So I'm sure the rest of the fellow commissioners will tell you the thing that my office hears the most is always speeding. It's the biggest complaint we get, so we appreciate your effort in trying to keep our citizens safe.
Thank you. So, yeah, we've wrote a number of speeding tickets out there. And going back to the dispatchers, so our dispatchers do go through crisis intervention training as well. And then the sergeant of the behavioral response unit does the training with all of our, our lineups and our dispatchers as well.
All right, thank you.
Commissioner Siplin.
Thank you, Sheriff. I have a few questions here. During the presentation, you mentioned that you were going to initially start off with 2 clinicians that will ride along with 2 deputies. But do you think that is a good number to start with based on the population and the numbers that you presented with the amount of calls that you've received?
Yeah, so obviously this is a pilot program, and it would be our hope that in future years to expand this unit. But for right now, it's the pilot program, and we are tracking everything, their calls for service, the times they interact with people in mental crisis, the times that other deputies call for them to respond, and all the different services they're doing, all the different follow-ups. So although the unit is small right now and really can't fit the needs of the entire community, just based on those success stories that I told you about, we already believe the program is a success. But our hope would definitely need to expand the unit in the future. Okay, so that was my final question to you, is knowing that currently you have an MOU with the agency and the funding is coming from the forfeiture funds, but so we can probably say in the near future that you will be putting this in your budget. And I don't know if you, in the process of collecting data, that you're going to do a cost analysis of what it would take to fully fund this program. So, yes, we definitely plan on including this in future budgets. To fully fund this program is around $500,000, and to actually expand it to what we want it to be at least for the beginning years is about $867,000. And what that covers is, a sergeant, a corporal, the 3 deputies, and the 3 clinicians. Okay, and also an analyst. Okay, thank you. And also during your presentation, there was no mention about dealing with the bilingual community. Can you address that about if, at least if someone is called out, do you have access to make sure that there are bilingual speakers if there's a need? Yes, great question. So one of our deputies is bilingual and speaks Spanish. And, we're very, very fortunate in this diverse county where we have an extremely diverse workforce here at the Sheriff's Office, and they could easily call another deputy to respond. If we have, Portuguese speaker, French speakers, German, then also through communications, they can be dispatched as well. And we're also cross-training one of our other deputies who is Creole speaking to train with the behavioral response unit and ride with them from time to time because of all the Creole speaking people we have in our community. Okay, and my final question is with the utilization of body cameras and the HIPAA privacy laws, how are you dealing with that when you arrive on the scene and someone, is suffering, truly has been diagnosed that they're suffering from a mental illness, and then you have that fine line between protecting, the officer, and then you have the fine line of protecting the privacy of the individual. So can you address that? Right. So our behavioral response deputies, they will have body-worn camera, or they do have body-worn cameras assigned to them. And just like every other deputy, probably deputy right now responding to someone in mental crisis who will be wearing a body-worn camera. But all of that, if the person is in some kind of mental crisis, all that is exempt through our law, so that that footage would never be released of someone who's in a mental crisis or needs medical attention.
Thank you, Sheriff. That is all.
Commissioner Gomez-Cordero.
Thank you, Mayor. Good morning, Sheriff Mina. I have several questions. I would have loved to have a briefing yesterday to avoid all these questions, but I'm going through the line that Commissioner Sipling, and she did made a very good point in regards to the lack of staff, and also when she mentioned bilingual. I would like to see also that the clinician be bilingual, not only the deputy or the person that's going to provide these services should be bilingual as well. Like she said, our population is growing. I wanted to ask you also, and I think you said it, who decide, when to call a clinician or when to bring them in, and you already answered that, the dispatcher and so. I wanted to ask you, do we have a crisis unit hotline?
Yeah, so anyone we do. Anyone could call 211 if they know someone who's in mental crisis, and our 211 system here in Orange County connects folks to the services they need, or can direct them to 911 if the person is going to commit harm to themselves or someone else.
Okay, is this going to be a 24/7 response by a clinician?
So right now it's not 24/7 because of the unit. And that's what we're doing right now. We're seeing, we're tracking everything as far as what areas are we receiving the most calls, what time frames are we receiving the most calls. So right now they're primarily working, through the evening hours and on some weekends. So, but as the unit expands, it would be our hope that we would have more and more coverage.
Okay. What will be the qualification for these clinicians?
So, and just going back to your other question, so they are on call. So if we have a situation where, we really think a behavioral response, unit response is required, they can be called out. And I'm sorry, your next question was?
The qualifications for the clinicians.
Yeah, so as far as the clinicians, they have, mental health training, everything that they do through BRU, as far as, they have schooling on this. They all have degrees. And like I said, we contract through BRU to make sure we're getting the most qualified people.
Are they going to be any outpatient referrals?
Yeah, absolutely. So that's one of the things they do. They refer people to the services they need. So a lot of times our behavioral response unit will go out and it will be an outpatient thing. We won't have to do a Baker Act. There won't have to be a hospitalization. We'll contact them or direct them to the resources that are best suited for what is happening to them.
So in the presentation, you said that BRU will have a follow-up. What does that mean, that they're going to go back to them? What did you mean with that?
Yeah, so many times we have individuals that continue, either their family members or them continue to call 911. And we deal with some of those people very frequently. And it'll be in those cases that the behavioral response unit will follow up with them. They'll check up on them to ensure that they're getting the services they need. Or say that they had directed them towards a service in our community, and we'll see how that's going. We'll contact the VA and see how that veteran is doing with their treatment. See if we need to respond back out to the house to kind of check on them and see how they're doing, and redirect them back towards those services, or maybe other services because that service wasn't working.
My last question: if the person still commit a crime and we know they have mental health issues as well. What will be the plan, or how will services will be continued if they are arrested and, you know?
So it's kind of complex. It all depends on the crime. You know, the more serious the crime, especially something that's violent or someone with injury, you know, the more likelihood that they'll be taken into custody, and then it may be up to the courts to decide whether that person should go through a criminal prosecution or whether it should be diverted because of their mental health and can't stand trial. But for low-level offenses, especially nonviolent offenses and minor crimes, our goal is to get them the services they need. Our goal is not to incarcerate people for low-level crimes, especially misdemeanors, and especially crimes that don't have a victim involved.
I just want to say, as a mental health professional, Sheriff, that as Commissioner Siplin said, I think we have a lot of issues coming up with mental health, and I think that we would need this program and more people to work on it. So thank you anyway for the effort and everything.
Thank you. I couldn't agree more.
Commissioner Bonilla.
I just have to say thank you to the board members for asking such great questions. They really did ask wonderful questions. You know, some could say that it's unfortunate that you all have to be involved in some of these issues, but I say it's really not, because you're part of the community and part of the solution. So I want to congratulate you on being so brave and being a leader to do something that is different and that is so innovative, and being part of the solution in the community here in Orange County and doing what you're doing, because you didn't have to do that. You could have left it all to us, you know, in Orange County to deal with it, but you took it, you owned it, and you're doing something about it. So I want to say thank you so much for that. And definitely, I support the program. I agree with my colleagues here that, you know, it's definitely needed to expand. And, you know, I'll say, you know, we have the jail system, the prison system, and, you know, it's known as something that you don't want to be there. Like, no one wants to be there. It's supposed to be a punishment. But it can also be a place where we can help people change their lives. So I think we really need to look at some of these systems in a way to help people rather than punish them. And what you're doing is doing that. You're not punishing someone because of some mental health issues that they have. You're trying to help them. So thank you.
Thank you for your kind words, Commissioner.
All right, Sheriff, I have a few questions. Given the data that you presented from some of the other jurisdictions, I'm just curious if any of them had something similar to our central receiving center that we have here in Orange County.
You know, it's really a hodgepodge. There's jurisdictions that have the central receiving facility. There's jurisdictions that did not, and they range in variety from side and scope and to the services that they have. But most everyone has something similar to the central receiving facility.
And in your research, how did the various jurisdictions fund the correspondent units?
From our research, most of them were funded through their budgets.
Was it a partnership budget where some of the funding came from the clinician side of the equation, or did it all come from public sector?
I believe in some of the models, it was a partnership. Yes, it was a partnership.
And there were various sizes of jurisdictions that were indicated, but it's hard for me to tell whether or not any of the programs were county-wide types of programs. Yeah,
so you know, Seattle, it's a large city, and they were several of them were Sacramento was a countywide system as well.
Okay. I am looking forward to the data that you will collect during the pilot period of time, and I'm not sure it was clear to me how long you intend to run the pilot program, if you can speak to that.
Yeah, for the entire year. So the entire remainder of the year, we'll run the pilot program.
So I'll be very interested in that. So thank you, sir. We have a couple of other comments. Commissioner Wilson has additional comments. Commissioner Wilson, you're recognized.
Sorry, I know it's going to be a busy day, and I thank you, Sheriff, so much. And actually, this is, just part of the discussion that this sort of spins, off of. And I do think that because of current events, law enforcement has had to absorb some of these wraparound services that have been either systematically defunded or somehow shuffled off the budget sheets from other areas. And that is across the state and certainly across the country. But I do understand that this is, at the very least, hopefully when we look at budget issues, prevention has to be part of the solution. And so when, we're going to pay now or pay later. So I do believe that looking forward to seeing how this pilot works and implementing that, and then coming up with a way to make, really some good long-term investments in that type of prevention. Additionally, to the homelessness situation, that we've had 13 homeless camp trespasses in District 1 since I took office in December. There hadn't been any in 7 years, and there have been 13 since I took office. Your office has been wonderful trying to help me piece together what was going on, because quite frankly, I was just getting calls from residents who saw people on the side of the road pushed out of the woods. And yes, many of those people are dealing with substance abuse issues, addiction, and mental health. And, it is much bigger than a single 911 call. It has got to be a comprehensive and holistic approach. And I do think that this is one component of it, and I really appreciate that as law enforcement, that really, once again, you're going to be so scrutinized about the way that I think any of this is decided. And I think we have to be very clear as leaders and as people that help communicate with our constituents and residents, that when those budget items come down, specifically what they're being used for. So if there is additional clinicians being trained, we need to get that out as clear and concisely as possible, so that that investment is understood by our residents, the same ones that call about homelessness issues and about being concerned about people on the side of the road after a homeless evacuation. But anyway, that was just sort of my pitch for trying to get that communication out when those resources are requested. And I, I'll say it again and again. I think we pay now or we pay later, and it makes so much more sense for the care and treatment of the people that we, that we love, that are in our families, that we live near, and also for our community at large to make that investment on the preventative end. So thank you so much, Sheriff.
Thank you.
Commissioner Moore.
I just wanted to add on the homelessness side. I had the opportunity to tour with the mayor of Apopka and a citizens group, the drop-in center with Donna Weiss here on staff on the east side. And so we're looking at possibly replicating that model. And so it's clearly, Mayor, to your point, we can get them to come and provide services, but there just aren't enough even when we get them to the drop-in center. So look forward to hearing more about additional opportunities and working together to address the homeless issues and mental issues, because they're really many times all wrapped into one. Thank you.
Commissioner Uribe.
Sheriff, I did actually have a question. I know that a lot of times the goal is to have the officers with the CIT training, and that is, obviously because of the time that's required, which many times we can't have clinical workers with every deputy, so the CIT training is supposed to help that level. Where are we percentage-wise on your sworn officers that have that training and can identify the mental health and the the signs accurately to try to identify individuals like that?
We're about 400 to 500 deputies trained, so that's pretty significant. So there's always someone out there who has the crisis intervention training, and we're kind of doing some different things. We're looking at putting on our own class where we can, put 40 or 50 deputies through the training. The other thing that we're doing is we're really working with the state FDLE, who sets the standards for new recruit training in the academies. Well, my ask to them and many other sheriffs and chiefs as well is to put that 40-hour block of crisis intervention training right at the end of the academy, so that before these deputies ever get on the street, they already have that in their tool belt. So that's a work in progress. I don't know if it will ever come to fruition, but that's what we're working on.
And Sheriff, you said 400 to 500 out of how many of your sworn deputies?
1,600.
Okay,
So
thank
that's
you.
about a third, yeah.
No, I mean, I understand what you're doing now is great, and two, compared to how many people, what we think 1.4 million people live in Orange County, is a slight, drop in the huge beach that's out there. But that CIT training is so equivalently important because it does have that first layer of identification. When so much is happening so quickly after going through your simulation program, it's seconds, not minutes or rationalization. So thank you, Sheriff. Thanks.
I agree. Thank you.
Commissioner Gomez-Cordero.
Thank you, Mayor. I just want to say that, Mayor, that you made great points about the comprehensive approach and, in mental health and homeless and all of that. And I just wanted to say that it goes back to mental health, but for example, if we have a homeless person and we give them a home, but we haven't treated them with why they get to being homeless, then we encircle doing the same thing again. So we have to, like Major said, we have to be in coordination and one with others and have those wraparound services, because we have to treat the problem. And sometimes the problem is not homeless. Sometimes it's more than that. It could be losing a family member and not being treated. It could be sickness or something. So I already also meet with the directors of the shelters here, and I think that we need more case managers around as well, that after we provide them services, we need to stay with them until they, be independent. But if we just leave them, we give you home, well, okay, we're done with you. In 3 months, they're going to be in the street again and homeless. And that's the same thing, as he said, with substance abuse and all these things. So anyway, I wanted to say that. Thank you.
And Sheriff, this is an action item for the board to consider today. What the sheriff is asking is for the confirmation, affirmation of his desire to expend the dollars from the forfeiture, the state forfeiture trust fund for this program. And is there a motion for
I'd like to
approval?
make the motion, Mayor. So moved for
Second.
the approval.
Motion by Commissioner Uribe. Is there a second?
Yes, second by Moore.
Moore, Commissioner Moore. All right. All in favor say aye.
Aye.
Opposed, no. The motion passes, and it is unanimous. And Sheriff, we look forward to working with you. All right.
Thank you, Mayor, and thank you to the commissioners. We appreciate your support.